Welcome to the Motivitystate podcast, the space where we dive into mobility, movement, biomechanics, neurology, and much, much more. Hello, everyone. This is Rado. I'm the host for the episode 2 of the Motivitystate podcast. Today on the episode, we have Dr. Ryan Foley from IKN, another of my mentors, who's going to share a lot of useful information about pain, about movement, about strategies of training, performance, and all sorts of things related. Just like before, I want to start with my personal story and how I came across IKN. For those of you who are not familiar, IKN is a company which teaches applied neurology to medical professionals, to performance and sports coaches, pretty much everyone interested and willing to learn, in a very practical and simplified way, where you can start applying the principles and the strategies right away. Actually, this is what brought me to them, because I've been looking into applied neurology and the benefits of it for a couple of years before I found IKN, and they were starting to get traction and share more and more content. And then I signed up for one of their workshops, which was supposed to take place in Croatia in 2020, but because of COVID, it never happened. So then they pivoted, just like all of us, and started transferring their content online. So I went through their level 1 and then to their performance course as well. So I believe the information that Dr. Foley is going to share today is very useful. Let him introduce himself and share more about IKN. So Dr. Foley, thank you very much for being with us today.
Yeah, thanks so much for having me. It's a pleasure. Yeah, so I'm a physical therapist by trade. I went to school in the US. I'm originally from Ireland, from a city called Waterford in the southeast of Ireland. And I went to the US originally to play soccer. I went over on a kind of a partial soccer scholarship to study physical therapy in school. So the goal was to always originally just try and stay connected to sports in some kind of way. And that's why I went down the physical therapy route while I went through school. Certain things caught my attention. The co-founder, Kyle Paxton, is the other founder of IKN. And through school, he was actually working with a gym right around the corner. And the owners of that gym were very heavily involved with applying neurology with their clients. And they were chiropractors. And the other guy who owned the gym next door to the clinic, called Dan Fichter, who's fairly well known in the US for applying neurology into sports performance type scenarios and training. And so he was learning all this very cool neurology stuff, and that piqued my interest, because when you're studying neuroscience in school, it really doesn't offer any kind of practical use at all. It's just about studying tracks that connect from different parts of the brain to different parts of the body, and there's just no practicality with it at all, unless, at least in that moment in school, you're looking at how you can actually work with the neurological population with clients with stroke or Parkinson's. But these guys are around the corner they actually were just around the corner from the university. They were using it with their clients who were experiencing pain, orthopedic conditions, musculoskeletal problems, not with clients necessarily with true neurological issues. And so that's really what piqued my interest in utilizing more practical neurology within more of a traditional physical therapy type of framework. But then what really pushed, I suppose, the desire to create a course like IKN was when I moved into New York City from Rochester in upstate New York. I worked there in New York City for a couple of years, and I worked in a orthopedic clinic. But in that clinic, we worked an awful lot with clients with amputations, right? So lots of lower limb amputations, and it was actually, I learned an awful lot about how neurology and the musculoskeletal system interact in a different way, not from physical therapists or neurologists, but actually from prosthetists that actually used to design these prosthetic limbs for those clients, because the research around that stuff is fascinating, and how you go about designing a prosthetic limb for an amputee, because obviously the nervous system isn't going to be able to directly engage with the prosthetic limb because it's not part of the body. necessarily. So what they do in the research is they study the features. They would refer to them as the features of our musculoskeletal system, our movement apparatus, we call it, and understand what features are present that are still able to handle stress, to allow us to move, to allow us to decelerate forces and manage forces acting on our body, but that don't require too much don't require excessive top-down neurological control where the brain has to kind of control things, right? And so they go about this process called biomimicry, where they try and mimic the features of the human body into a prosthetic limb, right? And I found that fascinating, because that's when you start to look into the dynamics of biarticular muscles, what biarticular muscles can offer us versus monoarticular muscles, what the importance of allowing the end point of a limb, the foot or the hand, to guide what happens up through the rest of the chain. And we had situations where clients would, because with an amputation, you typically are going to experience sores or wounds or skin problems around the residual limb, where the site of the amputation. And it was funny, because when clients would experience these problems at the residual limb, the physical therapist who worked with the prosthetist wouldn't necessarily just go to the wound, the side of the wound or the side of the skin problem, and say, oh, there's a problem there, let's fix it. But they would actually look distally in the prosthetic limb and say, okay, well, is that prosthetic limb doing its job to dampen the forces acting on the body? Because if it can't dampen the forces acting on the body, then we might experience a little bit more irritation or sensitivity or other issues around that residual limb. And I kind of looked at that through the same lens for like a client with lower back pain or hip pain, for example. What if the distal portion of the limb, the foot or the knee portion, can handle stress well, and now all of a sudden the proximal portion, the portion closest to the center of the body, is now taking on increased workload, or all the stress is being distributed through there. So then it's a case of combining those features of the body, of our movement apparatus, with more of a top-down neurological spin, and then creating a framework for that, and then implementing that into musculoskeletal rehab. Because it's not just about, because I know that you've taken some in-depth neuroscience courses as well, and I've taken a lot of them as well. It's all well and good when you're in a classroom full of 20 or 30 other people who want to try and solve problems by looking at other complex systems like the visual system and the vestibular system. But when you're inclined on a Monday morning with the clients with persistent back pain, who really doesn't have a great understanding of how their body works, for you to just try and go and do stuff through the eyes of the vestibular system, it's not gonna work with them, because they need to have that understanding of what's happening. And so that's where I think this integration between the features of our movement apparatus, and then combining that with more neurological approaches as well, can really, really help push things in the right direction.
Yeah, and I think you're about right, because one of the courses, not that it's a bad course, and I'm not calling them names or disregarding what they're doing. They're pretty good at what they do. But the course that I took worked really. It was a basic course, of course, and it worked on the visual, vestibular, and proprioceptive systems, which are the three main body and systems that we use to navigate around the world. But what I see oftentimes is that I'm a little bit slow-paced on implementing the new stuff that I learn, because I try to mix it up with the knowledge that I already have and see where it fits in the whole puzzle. Because a lot of my colleagues would go day one after they've taken the course and start randomly trying the stuff with their eyes or the vestibular and all of that stuff, which doesn't give us enough as movement professionals or as medical professionals wouldn't give us necessarily enough information about where the issue is, or it's not good enough assessment. So that's the thing that why probably I held back a little bit after the first course, and I dove in and started applying your stuff right away, because I was able to see the connections, and there was a lot more detail about the muscle contractions, the cooperating muscles into a movement, bearing and managing forces and all that stuff. And it wasn't so much overwhelming, but a few simple strategies that you can start applying right away. And then this combined with the knowledge that I already had from the past with like biomechanics and like all the mobility stuff in gymnastics made total sense to me. So definitely looking forward to learning more about neurology and going deep into it. But you briefly mentioned about like your fascination because Dr. Cobb was the other guy I learned from in the past. He actually shared the same thing because he went into neurology to fix his own pains because he was into martial arts for many years, and then he wasn't finding answers, spending money on chiropractors and all sorts of practitioners, and went into neurology to fix himself. But then he didn't find the answers into like the classroom, as you said, because in real life things are totally different. The stresses and the nervous system works in a different way. And then he went into the applied neurology. So what was your experience and how did you decide to go from the clinic and from working with the amputees into coaching professionals and like myself or other health professionals? And how did you collide your paths with Dr. Kyle Paxton?
Oh, so he was in my class. Dr. Kyle Paxton was in my class all through physical therapy school. We always had that kind of that common interest, and obviously he dove deeper into the neurology before me, because when you're working with athletes are kind of up for anything. You know, it's always easier to kind of try things in athletes when you're in a more of a gym setting, but when you're working with a client who's currently experiencing pain and there's lots of other unique limiting factors at play. There's lots of other psychosocial stressors at play there. It's not a case where you can do something with the eyes and the vestibular system and all of a sudden they experience less pain. But that being said, you can certainly stimulate these systems and have some kind of influence over their pain experience. Because again, pain is just an experience. It's an expression that your nervous system feels the need to express more top-down protection because it doesn't trust your capacity to handle stress. So really any kind of stimulation or input to the system can alter a pain experience. But for me, the issue is that like if I do something with the eyes or the vestibular system and it alters the pain experience, where do we go from there? You know, it doesn't give me any kind of clear markers to progress from. And that's why whenever I'm starting with a client and I'm assessing the client and then moving into treatment, I want to take more of a bottom-up approach first. I want to look at more the mechanics of the body first and look at these movement features. Can they handle stress through the biarticular tissues? Looking at the difference between the midline cooperations and the limb cooperations and understanding their past injuries, and then building up that low tolerance in a gradual manner, and then feeding in some top-down approaches as we move along. But it will depend on the client's unique past history as well. Like if I have a client with a history of concussions or any kind of head injuries, then looking at the eyes of the vestibular system within the context of a musculoskeletal problem, like a back pain or hip pain or knee pain or shoulder pain, then I might look at those systems a little bit sooner, you know, but I would try and keep it simple first because I have to recognize that a client is coming to see me with certain expectations of what physical therapy is going to look like. So in the first session, I start assessing their eyes and looking at the vestibular system in a lot of detail. They probably won't come back next week, you know, so yeah. I have to be respectful of that.
Yeah, like I totally understand what you mean, but probably in your case it's similar, just like with myself, because I got a lot of referrals, so people already come with some trust, and like even if I ask them to do some weird stuff which looks like mumbo jumbo or voodoo kind of shit, it's okay, and they do it, and like they see, and because I talk a lot, I try to explain, even if it's a bit overwhelming at times, I try to give them as much information. So because I know when they understand on a cognitive level, they'll be more willing to do the work, because they still need to do the work on their own. Like it's not a quick fix, come and I'll pop your back or I'll fix your ankle or something like that, because you and I would give them strategies. They need to work on their own, and then we assess and reassess and then progressively load afterwards. Definitely It's interesting what you shared about your approach when assessing and trying to recognize where the problem is, because I also start the same way. I also start from the bottom up, and then eventually start adding either visual vestibular work or actually take out one of either to work on the proprioceptive system as well. Because oftentimes what my experience is with clients is because of their line of work, they're sitting all the time, they're staring at a computer. Most people would need any kind of visual work like convergence, divergence, like some side to side movement, some flexion, like up and down movements of the eyes, dislocating it from the head. And stuff like that, and then I mix it with the thoracic rotation and the eye movements and stuff like that, just to prove a point, just to grab their attention sometimes, because oftentimes the head will be positioned like slightly to the left or to the right, which will compromise the thoracic rotation of the spine. But before I go into those, I'll check if the thoracic rotation is equal both sides, or if there's any limitations in the feet and everything else. Because as with a lot of your courses, you talk about overcoming strategies and yielding strategies, and being able to bear the forces that act on our body, which is like gravity all the time. But unless we have gravity, because people lose a lot of that capabilities because they're sitting all day long, vestibular system gets taken out of the equation because we're not challenged in any way standing up. And then also the lower body, with my clients, I like training the lower body quite a lot, because 2/3 of the body weight is up above the waist. And then if the legs are not capable of carrying your head, I mean, there's constantly going to be stress for the nervous system that you might fall and break your skull pretty much. So yeah, I actually pretty much take the same approach, and I'm pretty happy that you go the same way, because for a lot of people, when I explained the connection between, I just now I had a conversation about the feet and the shoulders, and the connection between why it hurts in the shoulder if your feet are not balanced, and people are like, very interesting. So yeah. I want to talk about pain and performance, because oftentimes the fitness culture has actually made us believe for decades that no pain, no gain kind of mentality. And then a lot of times, if it's a client who's office worker and comes with pain, that's easy. They just say it and it's fine. But oftentimes athletes, and even recreational athletes also, they go play their sports, but they push through pain because sometimes it's a alpha male, or if they just don't want to deal with it, and then it's going to go away. But talk more about the difference between pain and performance, and how you would approach cases like that, like the prerequisites you would need for performing certain movement or certain athletics endeavor, and then the guidelines, then the progressions. Pretty much, if you can give the basic principles that you teach and that you would advise clients or other movement professionals to start with.
Yeah. And I think it's really important to understand this from a contextual standpoint. The goals of the client is the goal of the client to achieve a change in their pain experience, or is the goal of the client to achieve a change in their performance? And really, there's not a massive difference when you really think about it, because I always think of it from two lenses when a client or an athlete comes to see me. Like a client, or there's always two general goals at play here. There's the cognitively, we call them the cognitively or the consciously generated goals versus the nervous system goals. So if I have a client comes to see me who has pain in their hip, for example, their consciously generated goal is to maybe be able to walk up and down the stairs pain-free, or could be to run 5K pain-free, or to lift a certain amount of weight off the ground pain-free. But the nervous system's goals is not the same as the consciously generated goals. The nervous system doesn't care whether you can walk up and down the stairs, or to run 5K, or do all of that stuff. It just wants proof of protection. It wants to know that you're not going to damage your body when you participate in these activities. So it just wants proof of protection. And I think the definition of protection for a lot of people is negative in a way, because people think, oh, you just need to rest to protect the spine, or to rest and to take anti-inflammatory medications, or to put heat or ice, or whatever kind of passive modality you want to think about. But for us, proof of protection involves loading the system strategically to establish proof of evidence to the system, to the nervous system especially, that the body has the capacity to handle its stress itself without too much top-down protection. And that's the key point there, is that we can protect our body, we can manage stress well without too much neurological control, where the brain's trying to control everything, right? Because that's obviously not going to, and you can see this in the research as well, when athletes try to consciously control their movements during a sporting situation, they're typically going to suffer from less performance, or it's going to negatively impact their performance. So those kind of thought processes are always going through my mind. And so in the back of my mind, I'm thinking, okay, how do I actually allow for this individual system to prove or supply evidence of protection to the nervous system, so it doesn't have to feel the need to express this much pain or increase muscle activity or increase tone? Because there's only a couple of ways that the nervous system can actually express the need for extra protection from a top-down standpoint, from a brain-to-body standpoint. And those come in the form typically of increased tone, discomfort, pain, so on and so forth. It could even be feeling anxious. It could be a change in your breathing pattern. All these things are expressions that, again, there needs to be some kind of change in your behavior, right? So it depends on the context. But this is where the beginning of my assessment process starts, because I want to understand the unique movement history of the client. So let's say, for example, with the client, let's say an athlete who's having back pain when they're running, for example. I need to look at that local experience of pain around the lower back within the context of the lower limb and the midline. Okay. And you know this from taking our course, that we take a very much a distal to proximal type of mindset and thought process. And the reason is because, like, have you ever looked into the constraint-led approach to
No, I haven't.
There's this kind of common constraint triangle that gives us an insight into the interaction between the individual, the environment, and the task.
Okay.
So our ability to move in certain ways is all about the integration between the organism, the human, within an environment, and what tasks they're actually trying to achieve. So it's all about this cooperation amongst all those different layers. But what we want to consider is that your body always has to manage forces and decelerate forces first from the environment. The environment, and you mentioned it as well, gravity is always it's always acting on your system. It's always trying to put length into your tissues, or to pull you down towards the ground. So we always have to manage that first. So even before I go for a run, or before I reach for this water bottle, for example, I have to manage gravity even before I carry out that task. While I'm sitting here right now, I'm managing gravity. I could crumble to the ground if I didn't manage gravity well, right? So if I'm in an upright standing position, we have to consider, well, what components of our movement apparatus typically is in direct contact with the environment. And it's going to be the end point of the limb, the hand or the foot. Okay. So a client with lower back pain experiencing the increased pain when they go for a run, for example, I'm thinking, well, can the limb handle stress from distal to proximal? Can the foot, when the foot hits the ground, can it dampen the forces acting from distal to proximal to allow for a sharing of forces across that limb so that the back can stay adaptable? Because the lower back, the midline of the body, is very rarely in direct contact with the environment, right? So it depends on the load sharing capacity or the load dampening capacity of the limb to stay adaptable. Meaning that if the limb loses that load sharing capacity to dampen forces, then what's going to happen? We might have to increase the tone around the midline to manage forces. So now you have a lower back or a hip, for example, that's doing the job of the distal tissues, right? And so I'm always thinking about that. Do I need to look at the limb, or do I need to look at the midline with a little bit more focus? And this will all depend on an assessment. We will assess the lower limb, we will assess the midline, and understand, well, do they need more load sharing capacities around the midline, for example? Let's say that we have two athletes with identical symptoms around the lower back. Client one has had a list of midline past injuries. they've had back pain in the past, they've had ribcage injuries, they've had concussions, versus client number 2 has had no midline issues, but a lot of ankle sprains, a lot of knee issues, a lot of hip issues. I'm probably going to be thinking along different lines for each of those clients. For the client with the past midline issues, I'm probably going to be looking at the capacity of their midline to share stress across the pelvis, across the rib cage, across the spine, into the other tissues. For the client with the lower limb past issues, I'm going to be looking at the capacity of the foot and the ankle, the knee, the hip to share force as well, right? But it's done within the context of how the environment acts in our system, looking at force acceleration capacities, right? And that's where you're looking at biarticular tissues, right? You're looking at the ability of the foot and the ankle to express the capacity to act as a quality platform for good distal proxima. Because when you're running, for example, you're running at a slow and moderate pace is really going to shift a lot of the workload into the distal tissues more so, versus if you're sprinting, for example, that's going to shift an awful lot of the workload proximally into the glutes, into the hamstrings. Right? So again, it depends on that context as well. The task, are they having pain when they sprint, or are they having pain when they just go for a jog? And so it's really reliant on the context of the task and their past injuries. But generally, I'm looking at the capacity of the biarticular tissues to take on that role of transferring force as well across the limb. When you look into the research around biarticular tissues, looking at the gastroc, looking at the hamstrings, the rectum, these tissues take on a role of transferring forces and dampening forces that act on our body, to decelerate the forces, to allow us to manage them better. And that for me is crucial, because when you look at the lower limb from a joint kinematic standpoint, and you look at it from distal proximal as well, when you look distally at the foot and the ankle, it's a lot of complexity there. There's a lot of complexity around the tarsal bones. I look at it from a distance standpoint between the joints, and you have a very short distance, very small distance between the joints and the foot, compared to when you look at the long bones of the tibia, the fibula, the femur. There's a very big jump in the distance between the ankle and the knee and the hip. And so there has to be muscular features in those areas that allow for a transfer of forces. Because when you have a complex joint kinematic organization like the foot, the interaction between the bones will help to share those forces. And it's the same thing in the spine. You have a lot of segmentation throughout the spine, through the rib cage. So the segmentation allows for that sharing of force. But with the femur, with the tibia, you don't have that segmentation in the femur. Can you imagine having a femur that looked like your spine, a tibia that looked like your spine? It would be a system that would be impossible to control, So we have to have other features from a muscular standpoint to transfer those forces. So I would be looking at those. So looking at the capacity of the lower limb to handle stress well, and I need a good solid platform, a good responsive platform of the foot and the ankle that will allow for a better environment to allow for these biarticular tissues to distribute stress well, so that the midline tissues can stay adaptable, right? Because I want my midline to stay nice and adaptable when I'm going for a light jog or a moderate run. But when I'm sprinting, there's going to be a lot of tension throughout the whole body. Yep. I guarantee you, if I had Usain Bolt and I put him on my table and I measured his hips, I guarantee you would see a limitation in rotation in his hips. I guarantee you we'd see some limitations throughout the spine as well, because for the nature of his sport, he's trying to run as fast as he possibly can over the course of 100 meters. So he's trying to put as much conscious attention into that sprint as possible. He could be even holding his breath for the whole sprint. So for me to put a lot of variability back into his system might not be the best thing for the nature of his task that he's trying to complete. So it always has to be specific to the client's tasks. And that's where the constraint triangle comes into play, because you have this interaction between the organism, the unique individual, their past injury history, their unique movement history, the task that they're trying to achieve. Are they trying to run faster? Are they trying to just get through a slow jog? But the environment never changes. The environment, the forces, the unpredictability, the complexity of the environment is something that always generally remains constant, in the sense that the environment is what will really drive load into the system. And so that's what the nervous system wants to manage first. It wants to manage the environmental forces first. And in the context of trying to prove protection to the nervous system, if I can prove to the nervous system that we have the capacity to express good load tolerance through these movement features, like the endpoint control of the limb, the biarticular tissues, and looking at, there's lots of other features as well, within the context of a very complex environment, then that gives me better building blocks to move upon then from there within the context of their task. So that's what I'm looking at first. I'm looking at how can I allow for a movement system that can better manage the unpredictability, the uncertainty of environmental forces. And then we have to look at the features that allow for that. And then we're moving towards more specific type training programs as well. All right, so hopefully that made a bit of sense.
Yeah, it does, and it makes total sense. Also, about I keep telling people about the importance of even before I had the science that you just explained about the distal to proximal, about the hands and the feet and all those things. I was still talking to people and telling them that in like office environments in our daily lives, we rarely use our hands like with something like sharp, with something like different textures. So we don't receive enough information there, and there's lots of receptors, because like when we test if the oven is hot, we normally test with our hand. We don't go with our head in, right? Like, so a lot of receptors here, a lot of receptors in the feet. Chinese medicine also refers a lot to a lot of like points and like massage and all that stuff. But we put the shoes on, like the high heels or whatever, like a high sole shoes, so we don't have good contact with the ground. Then we don't have any touch with our hands, and then a lot of receptors in our tongues, in our eyes, and like pretty much we disturb all our sensory information, and then what we get as an input to our system is not clear, and then the output is oftentimes like pain or discomfort or something like that, because our system doesn't get enough information to extrapolate and to have more options and to feel safe, as you said. And like it's all another thing that which is also interesting after watching someone going through your courses is like, for example, when you're a kid, when you're a baby, they give like different textures. They give them plastic, they give them wood, they give them sharp or not so sharp, but like different objects to sense, so that their nervous system starts to experience those things, so they're more aware. And oftentimes you'll have like the babies will hold and bite or look and grab and use more than one system. And this is something that I think it's not thought about when people are being assessed, and then when their client or coaches and medical professionals are creating systems or strategies in order to get people out of pain. Oftentimes people will go for the passive approach with like the massage, or oftentimes when they have pain. Just recently, like a couple hours ago, I had this conversation. Lady's knee hurt, and she would say, yeah, I used to go swimming and I'll ride a bike, which is oftentimes the advices a lot of doctors will give. But again, unless you teach your system to bear that load and forces, that even during walking, because this is the most natural human thing, you'll have to walk from one room to another, even if you don't do your 10,000 steps. And the knee is still going to hurt if you only like swim. Swimming is great. I mean, I'm not against swimming, but people refer to it as the thing which fixes everything, or the bike or whatever. And it's not really it. So it's understanding. Yeah.
I don't know why that's the case, because we have that same exact situation in Ireland, where if someone has pain, the doctor will say to them, oh, go try swimming, try cycling. But those are two things that do not teach your system to learn how to manage gravity, because swimming, you don't have to manage gravity. Yeah. Cycling is a very force production dominant sport where you're not in contact with the ground, you're producing force. So you're putting a lot of load into the quads, into the glutes, into the more proximal tissues, and you're not teaching the system how to distribute stress over a broader surface area. So that's important to consider, as well as the strategies that you are using to teach the system to manage forces with. So if you're using a very force production biased strategy, it doesn't mean like cycling or like squatting and bringing your tissues through a lot of lengthening and shortening. That doesn't necessarily teach your system to better manage forces. It teaches you to overcome those forces in a very force production biased manner. But you need to look at biarticular tissues. You need to allow for a distribution of stress with not too much change in the movement of the joints. Like looking at something like a single leg deadlift with a little bend of the knee versus a split squat. That's a completely different strategy that's going to happen. When you're going through a split squat, for example, you're taking the proximal tissues through a lot of lengthening and shortening. And the mere act of lengthening and shortening tissues is an energy expensive process for the nervous system. So if you're trying to get better at producing force, then yeah, that might be a good option. But if you're trying to get better at distributing forces over a greater surface area, you might want to think about not bringing your joints through a very large range of motion and just taking advantage of those other features like biarticular tissues, like distributing the load through the endpoint. But it depends on what the client's trying to get better at. But yeah, like that's one thing that we really put an awful lot of emphasis on is not just loading the system for the sake of loading the system. What kind of strategies are you trying to facilitate from a client perspective? What kind of strategies are they using to manage those forces that you're actually delivering? Because everyone's always worried about information delivery. What can we do? What can I give the system? What kind of stretch can they do? Or what kind of strengthening drill can they do? But very few people think about what kind of strategies the client is using to manage those forces, and then how is that being translated into a more robust system? Because I could, when I'm walking down the street, I don't split squat down the street when I walk. I'm not going to be able to get very far because I'm taking those tissues through a lot of lengthening and shortening. Right, but that might be important if we want to improve awareness of those tissues that need to lengthen and shorten. But when it comes to sustaining movement over a prolonged period of time, I don't want my tissues to go through a lot of lengthening and shortening, if that makes sense.
Yeah, and
so I want to dampen forces.
Yeah, definitely, and it totally makes sense. And now, as I think about it, like the more proximal tissues work being more energy expensive, like people nowadays being like chronically tired, chronically fatigued, very stressed out, it totally makes sense that the system is gonna start like limiting the movement in the proximal tissues in the hands, wrists, feet, and all that stuff. And especially with split squat, the example that you just gave, oftentimes there will be no toe extension, and which will limit their ranges of motion, so they cannot really distribute more load onto the back leg, so that it's all like wobbling around and not being able to come up without like flexing through their spine and stuff like that, which are compensatory strategies their bodies use. And then this brings me to the next question, which is, I mean, it's the myth about the perfect posture, because I've been talking about this because everybody in the office environment talks about ergonomics, the perfect posture, pulling your shoulder blades back and down, sitting upright, and using exoskeletons and external strategies like chairs and stand-up desks and all of that to facilitate for that process to happen. But I keep telling them that your nervous system needs to relax, your extensor muscles need to be able to relax and not be overworked all the time. Because if your spine is doing your legs work when you're walking, and it's doing your legs work or your systems work while you're standing and sitting upright, I mean, you're not going to last very long. I mean, your lower back's going to start hurting at one point. And again, realizing the difference in approach that you need to take and the different strategies, because a lot of people will work on the strengthening the extensor muscles, strengthening the back muscles, and like you need to pretty much allow it to relax so that the reflex of the muscle kicks in, and then it functions like automatically. You don't have to force yourself into the position because the body knows what to do. And also, like with especially stretching, a lot of people will continue stretching their hamstring as crazy, and they continue not being flexible. And I'm like, if you go for the simple Jefferson curl or the spinal flexion exercise, you start making the connections and seeing where they compensate. Because if they're not able to load the metatarsals, the front of the foot, they shift their weight back, which naturally lengthens the hamstrings, and they feel tight all the time. Or if they're gripping their toes because of uncertainty, this will kick in the hamstrings again. So they're both stretching while flexing them. And then 100% almost of the times, I would see that the problem is into the ability of the spine to segmentally and flex and extend, specifically in the lower back, because this is the stable component of the spine. And people with herniated discs in the lumbar spine, 100% lack of flexion. And it's not only, this is probably not only because it hurts, but because they were not able to do it. And at one point it just happened. And on top of that, the medical professional, the doctor or whoever is going to say, don't flex that spine. Don't do stuff, and then just wait for it. And then whatever happens, and live with it. Which is not the approach we take. We start learning slowly that spine to load, and oftentimes within an hour or so, I'll have a client who's not been able to touch the floor with his fingers, be able to go all the way down, and they're like mind blown. And I'm like, yeah, just like strategies without pain to teach your body that it's possible.
Absolutely, yeah. I think for some reason that we've learned that perfect posture is about, like you said, pulling everything on the backside of the body into more of those tissues will express more concentric behavior. You're pulling the shoulders back into retraction, you're extending the spine. And I think you can think of it from a muscular standpoint or a joint standpoint. From a muscular standpoint, there's just going to be a lack of contractile variability in those tissues. And it's not that this is a bad thing, but think about what information you're delivering to the nervous system in terms of how the nervous system can distribute controls through that area. Then if I'm teaching the system to concentrically contract those tissues all the time, the nervous system is not developing the capacity to share load across that spine. We're not giving the nervous system the capacity to allow for the joint kinematic segments to share that load. Because when you're pulling the spine back into extension, you're taking the spine from more of an open pack position in flexion to more of a closed pack position, where it is safer, but it's not a scenario that allows for adaptability. And then you also have to think about it from a standpoint of if you're sitting down all day long and you have this extension of the spine, again, you're delivering a lot of concentric information to the nervous system at the midline, but the lower limbs aren't developing the capacity to handle stress either. So I always think of it from a standpoint of what do your movement behaviors on a day-to-day basis, what kind of information does that deliver to the brain, and then how does that information change the way that the brain interacts with that portion of the anatomy? Because I always think about it from a standpoint that the information that you deliver to the nervous system will change the nervous system's estimations of the capacity of your system to handle stress. So if I'm never teaching my lower limb, for example, to handle stress, and it could, because I'm sitting down all day for like 8 to 10 hours per day, and then I try to go for a run, then I haven't developed that awareness, that estimation from a neurological standpoint to trust the lower limb's ability to handle stress. So we might see a pain experience or an increase in tension or tone. And typically where you're going to see it is at the junction between the limb and the midline. Everyone always gets that tension around the upper trap, the lat, the shoulder, or the hip, the lower back. We see it at the junctions between the limb and the midline, because that represents a junction, you can say, between two different neurological control areas, where the nervous system is going to control the spine very, very differently to how it controls a limb, for example. Mm-hmm. And one of the biggest reasons is because the environment doesn't act directly on the spine. So we depend on both, really. We depend on that capacity to segment the spine and distribute load and restore some contractile variability to those tissues. But the capacity of the spine to also express that variability in movement behavior actually depends on the limb's ability to handle stress from distal proxima. Meaning that if you could do all the work around the spine that you want, but if you don't restore the capacity of the limb to handle stress well from distal proxima, you're not creating a nice environment where the spine can actually remain adaptable on top of a nice quality load sharing lower limb, if that makes sense.
Yep, yeah, and that's totally my approach. Also, like as we mentioned earlier, I start bottom up, working on the lower leg, going from the foot, ankle, knee, and then the hip, and then working on the spine, and then putting everything together so the system can actually realize that these things coordinate and cooperate well, and then bring it into one global movement where like the body starts to experience that it has control, has more options pretty much. So it's not about good or bad posture, it's like having options. And like oftentimes, because when I first started coaching body weight stuff, I transferred from lifting weights and coaching with weights, free weights, into like mobility and gymnastics. Now I see oftentimes people coaching mobility for the sake of mobility, and again they lack context, and just becoming more mobile doesn't mean anything, because having more options is not always the best thing. For example, if you're a power lifter or if you're a sprinter, as you said, you don't need to be more mobile, you need to be more strong and more stable and like be able to generate force. And whereas if you're like long distance runner, for example, you would want your rib cage to be able to move freely. You would want like your wrist to be able to deviate. You would want your foot to be able to dampen force really well, and all that stuff. So as you said, it's really a perspective shift when you're working with clients, when you think about your own movement and your own disciplines. And this is what I constantly talk about with my clients, because they would see the next guy doing the crazy stuff on Instagram or some other social media, and they'll be like, I want to do that. And I always ask about their goals and why they want to achieve this, because if it's about for the cool photo, it's fine, but it's not going to have it's not going to be sustainable. It's not going to last long. And then they get discouraged, because the process oftentimes achieving the mobility component takes a long time. Maintaining it's easy, but achieving it is long, and people get discouraged in the process. So yeah.
And you could also have situations as well where you have a restriction around a local area, like a knee joint, for example, that doesn't bend well, but the local restriction could just be a top-down neurological strategy of increased tone, because the nervous system doesn't trust the limb as a whole to dampen and share stress. So it's very rare that I would see a muscle that's truly short. You know, when people talk about muscles that are long or short, but it's really there's just too much muscle activity in that tissue, and then that tissue will express a certain behavior, and then that behavior might not allow for those load sharing capacities. And so sometimes you don't even have to work on the local mobility, but you restore these load sharing capacities, and all of a sudden you see these local restrictions begin to open up.
Yeah, exactly. And this is when if you use that strategy and everything falls into place and people no longer feel the pain, and they're like, what did just happen? And like they're like, they can't believe it. They cannot rationalize it in their heads. And I think it's our job as professionals to give them the simplified version of the connections between the different body parts, because once we educate them, I mean, they're self-sufficient in a way. And this brings me actually to my last question for today. Where would you recommend that people start, like self-assessment wise, practice wise? Again, like if they're totally new, or even if they have a little bit of experience, oftentimes I see that being physically active doesn't mean you're pretty aware of your movement capabilities and like movement restrictions. So what would be your advice from your experience and working with clients? What do you advise your clients to do?
But for me, I always try to understand the client's past injury history, their movement behaviors on a day-to-day basis. So if somebody is sitting down an awful lot throughout the day, I would want them to direct a little bit more focus on developing a better insight into the capacity of the lower limb to handle stress well, right? So I'll be looking at the capacity to hold isometric strategies for a certain duration. I would be looking at the local movement capacity of the ankle, the knee, the hip, within the context of what kind of directions of movement need to be displayed to allow for deceleration of forces. So for example, very simple way to look at it is, if you look at the ankle and the foot, for example, what would be a local movement capacity that would display to me that the system can decelerate force as well? And it would be the dorsiflexion capacity of the foot and the ankle. Whereas if I want to improve my force production behavior at the foot and the ankle, I'd be looking at the plantar flexion capabilities. So dorsiflexion pronation versus plantar flexion supination for force production capabilities. Same thing with the knee, looking at knee extension, tibial external rotation for knee extension of force production capabilities, and more knee flexion, tibial internal rotation for force acceleration capabilities. But really first, I'd be looking at the capacity of the biarticular tissues to handle stress. So looking at how well the gastroc, the hamstrings, the rec fem can all handle stress well. And looking at the movement capacity on the hip too. So I would put an awful lot of emphasis on building isometric capacities with focus on what kind of strategies you're using to manage those forces. So we spoke about, or well, you mentioned briefly, the difference between overcoming versus a yielding isometric strategy as well. So all these things can really come into play as well, versus someone who is standing up throughout the day an awful lot of the times, where their lower limbs might be taking on a decent capacity to handle load well, but maybe the midline might not be able to maintain that adaptability if we're standing up all of the time, and our spine has to constantly remain upright against gravity. So sometimes, again, I'd be looking at the rib cage's ability to move and to move through full excursion, breath coordination capacity. Even looking at a simple toe touch and looking at the capacity of all the tissues along the back side of the spine to relax and unload. And if somebody has a difficult time expressing the ability for all the posterior tissues on the back side of the body to relax and unload, that's when we might be looking at improving someone's breath coordination, how well they can take their rib cage through full excursion, how well they can allow for the pelvis to move through full excursion, how well they can allow their head to move through full excursion, even perhaps looking at the vestibular system as well. So it really depends on the movement behaviors, the daily movement behaviors of the client. Because I always, whenever I have a client that comes to see me, I always want to get an idea of what they do on day-to-day, from a day-to-day standpoint, because that gives me an idea of what tissues are experiencing load in what kind of way. If someone's sitting down all day long, I know the lower limbs aren't developing that capacity to handle stress well. If someone's standing up all day long, I know the lower limbs are probably developing that better capacity. Maybe it's more of a midline issue. Someone has more pain in the morning versus the evening. Someone has more pain in the morning. Maybe it's a case where the midline is more the issue that needs to be addressed, because again, the rib cage should be moving throughout the night, compared to someone feels better in the morning, worse at night. Then it might be a case where especially if they're moving around all day, maybe it's the lower limbs that don't have that force or load sharing capacity that they need to display. So it's really about stepping back and considering your day-to-day movement behaviors. Look at it from a body region standpoint. Might you need to look at the lower limb, the upper limb, or the midline, and then break it down into what kind of features each body region might need to display to allow for quality load sharing, to restore a much more robust body region, you can say. When it comes to the limbs, you want to be looking at the biarticular tissue's ability to handle stress, and distributing that from distal to proximal through the hand or through the foot. When it comes to the midline, you just want to be looking for movement capacity. Again, I'm not doing an awful lot of isometric strategies, the midline typically. I just want to look at breath coordination, look at their ability to move those segments through full excursion.
Mm-hmm. So pretty much coordinating, because some people will be listening, just wanted to clarify, pretty much when you talk about breath coordination, you're talking about breathing capacity combined with your rib cage and spine movement, along with the pelvis, of course.
Exactly. Yeah. So obviously recognizing inhalation versus exhalation dynamics. When you inhale, when you think about taking a nice deep inhale and you hold at the top, your posture is automatically going to get better. Right, and if we're stuck in this kind of very extended spine position, typically that's going to couple along with more of a rib cage that's biased more towards inhalation. Mm-hmm. So maybe we need to work on allowing for the rib cage to flex a little bit more, to allow for the diaphragm to relax a little bit more, and trying to extend the exhale a little bit longer. Like if I have somebody who really struggles to allow for the spine to relax, the posterior spine, it might be a case where if I'm doing some kind of loading strategy through the lower limb, I might have them use more of a per slip breathing strategy where they're really trying to extend the exhale, bring a little bit more force behind the exhale to allow for that ribcage to move through that depressed position, relax the diaphragm. And then as they develop that better capacity, then we're moving towards more of a nasal breathing strategy where we can just keep things nice and gentle from a ribcage movement and the breath coordination standpoint. Because ultimately the goal is to, from our standpoint anyway, to restore robust movement qualities, is to put all the stress into the limbs and allow for everything in the midline to be nice and adaptable, to allow for the breath coordination, the ability to inhale and exhale to be nice and adaptable, that they can experience both, and then to allow for those other couplings between the pelvis and the head to ride along with that as well. Right, but it's difficult to be specific because it depends on those goals again, the consciously generated goals and the nervous system's goals. And everything that I speak about now is without context from a specific client, is all nervous system goals to establish better protection.
Yeah, I mean, I understand what you mean when you say it's hard to be very specific, because it's like with the example that you gave a couple of days ago about case 1 and case 2 of lower back pain and injuries through the midline and injuries through the lower leg or the legs, the lower body. Sometimes when a person asks me about to advise on exercises about their lower back, and I'm like, I don't know. I mean, I have to do an assessment. It's not like one quick fix that will solve your problem. So it might be a few things combined. So yeah, you never know. And this is why, especially with like office people and people working from home nowadays, mostly, I would always advise them, have a stand-up desk, have a sitting desk, and spend some time sitting on the floor and doing stuff like there, reading, chatting on your phone, whatever, because you actually change your posture and you don't get stuck in that perfect one. So that to me is the best. Cool. So I will share some or all of your information online. If you allow, I can share also your personal profile as well as IKN's on Instagram and then Facebook and all the social media and website. If people want to learn more or if they have any questions, I guess you're pretty open to chats on social media. And then if you have any questions to myself as well, feel free to reach. Once again, it was a pleasure. Very nice talk again, as usual. Hope we can do this again sometime in the future, building up on top of what we've already discussed. For everyone who joined, thank you very much for taking the time to listen. I hope it was informative, and I'll see you next time.
Thanks so much.
Thanks.